This is Caitlin.
This is Jordan.
This is Kinsey. We did our group project over patient safety for fall risk. The guideline objectives for fall risk are to eliminate all falls with injury through a fall prevention protocol in the acute care setting, and to increase the percentage of patients who receive appropriate fall risk assessment and falls prevention interventions. One article that we read is about how knowledge is not the only thing that has to go into whether or not nurses are taking care of patients for fall risk. One of our questions is nurses' adherence to guidelines due to a lack of facilities and equipment or to a lack of patient-centered care? A study showed nurses perceived the barriers to fall prevention program implementation as being related to a lack of knowledge. However, increased knowledge on fall prevention via educational interventions did not guarantee effective program implementation. A successful strategy may need to equally address two educational goals, one being promotion of nurses' professional knowledge and skills in implementing a fall prevention program, and two, cultivation of nurses' attitudes in treating patients as their own families.
Standards of care. Assess environment and patient. Use standardized fall risk assessment tools, documentation, communication, education, identify risk patients, institute general safety protocol, follow-up monitoring of condition. Care planning. Assess for fall risk, reassess periodically, assess for safety of the individual's environment, educate the client and the family on exercise, home safety, footwear, preventing falls in the home, and initiate nursing interventions. Intrinsic risk factors would be age-related changes, such as vision, balance, and gait, psychological, changes in mental status, medical conditions, multiple medications. Extrinsic risk factors, physical environment, poor lighting, rugs, spills, lack of handrails, assisted devices like canes, walkers, and wheelchairs, footwear like low heels, slip-resistant soles.
Nursing interventions include patient education, bedside wrist sign, staff education, alert wristband, footwear, review after fall, toileting schedules, medication review, environmental modification, movement alarms, bed rail review, exercise, hip protectors, and urine screening. And for the clearinghouse interventions and practices considered, all of these are important to the clearinghouse, so these are what they included on that website. It's obtaining organizational support for falls prevention program, establishing a process for evaluation of the hospitalized patient for risk of falling. To do that, it's standardized assessment tool and injury risk assessment. 3, performing risk assessments to identify risk factors such as cognitive dysfunction, impaired mobility, medications, and environmental risk factors. 4, communicating risk factors between you and your patient, such as visual communication, visual identifiers and cues, communication to patient and families, patient education, and communication to members of the healthcare team who come in contact with the patient. 5, performing risk factor interventions, universal fall interventions, including behavioral interventions and impaired mobility interventions, environmental interventions. 6, observance, surveillance, intentional timed rounding, such as your 2-hour rounds and things like that, and then sitters that stay in the room constantly. 7, auditing, continuous learning, and improvement. That is our poster.